88 kes yang telah pulih dan dibenarkan discharge pada hari ini. Ini menjadikan jumlah kumulatif kes yang telah pulih sepenuhnya daripada jangkitan COVID-19 dan telah discharge daripada ward adalah sebanyak 915 kes, iaitu bersamaan dengan 26.27% daripada jumlah keseluruhan kes. Sehingga 4 April 2020 jam 12.30 hari, terdapat 150 kes baru yang telah dilaporkan. Ini menjadikan jumlah kes positif COVID-19 di Malaysia adalah sebanyak 3,483 kes. Daripada jumlah 150 kes baru yang dilaporkan, 80 adalah berkaitan dengan perhimpunan di Sri Petaling. Sehingga kini seramai 99 kes positif COVID-19 sedang dirawat di unit rawatan rapi. Daripada jumlah tersebut, 50 kes memerlukan bantuan pernafasan. Daripada maklumat terkini yang dilaporkan ke CPRC Kebangsaan, di duka cita dimaklumkan bahawa sehingga kini terdapat pertambahan 4 kes lagi kematian berkaitan dengan jangkitan COVID-19. Justru jumlah kumulatif kes kematian COVID-19 di Malaysia adalah sebanyak 57 kes, iaitu bersamaan dengan 1.64% daripada jumlah keseluruhan kes. Kes kematian ke-54 iaitu kes 2149 merupakan perempuan warga negara Malaysia berumur 85 tahun dan mempunyai latar belakang penyakit jantung. Beliau telah dirawat di Institut Jantung Negara pada 23 Mac 2020 dan beliau disahkan meninggal dunia pada 28 Mac 2020 jam 12.10 pagi. Kes kematian ke-55 iaitu kes 860 merupakan perempuan warga negara Malaysia berumur 66 tahun dan mempunyai latar belakang penyakit darah tinggi. Beliau telah dirawat di Hospital Sultan Ismail Putra di Kelantan pada 18 Mac 2020 dan disahkan meninggal dunia pada 3 April 2020 jam 4 petang. Kes kematian yang ke-56 iaitu kes 2850 merupakan lelaki warga negara Malaysia berumur 56 tahun dan mempunyai latar belakang penyakit jantung. Beliau mempunyai kontak rapat dengan kes 1031 dan telah dirawat di Hospital Umum Sarawak pada 30 Mac 2020. Beliau disahkan meninggal dunia pada 3 April 2020 jam 4.16 petang. Kes kematian ke-57 iaitu kes 1575 merupakan lelaki warga negara Malaysia berumur 61 tahun dan mempunyai latar belakang penyakit kencing manis. Beliau telah dirawat di Hospital Tengku Ampuan Afzan, Kuantan, Pahang pada 23 Mac 2020. Beliau disahkan meninggal dunia pada 3 April 2020 jam 10.25 malam. Kementerian Kesihatan mengucapkan takziah kepada semua ahli keluarga mereka. Adalah dimaklumkan bahawa sehingga kini kebanyakan kes positif yang dikesan adalah berkaitan dengan mereka yang menghadiri perhimpunan di Sri Petaling, iaitu 1,545 kes daripada 3,483 kes keseluruhannya, iaitu bersamaan dengan 44.36%. Kluster ini merupakan kluster yang terbesar setakat ini dan telah mempunyai beberapa generasi kluster jangkitan, misalnya melibatkan ahli keluarga mereka, kontak rapat di masjid dan juga di madrasah tahfiz. Kementerian Kesihatan akan terus bekerjasama dengan pelbagai agensi bagi mengenal pasti dan menguji semua kontak rapat di kalangan kumpulan yang berisiko tinggi ini. Orang awam juga disuruh agar menghubungi pejabat kesihatan daerah yang terdekat untuk disaring sekiranya menghadiri ataupun mempunyai kontak rapat dengan mereka yang menghadiri perhimpunan tersebut. Orang awam dipohon untuk memberikan kerjasama kepada agensi-agensi yang terlibat dalam mengekang kejadian COVID-19 di Malaysia. Seperti dimaklumkan, tempoh 2 minggu fasa kedua PKP adalah amat penting di di mana kerjasama semua pihak adalah amat diperlukan bagi memastikan rantaian jangkitan COVID-19 dapat diputuskan. Justru Kementerian Kesihatan Malaysia ingin menasihatkan orang ramai untuk duduk di rumah sambil mengamalkan etika kebersihan iaitu kerap membasuh tangan dan jarakkan diri antara satu sama lain. Sekiranya mempunyai gejala, gunakanlah penutup hidung dan mulut. Sekian, terima kasih. Kalau ada apa persoalan? Yeah, we have a list of hotels that have been used for quarantine. So, but will be allocated as when they come, when the passenger comes back, for example, in KLIA. So we will allocate one hotel and then we quarantine in the hotel. We are looking into collaboration with the police, whereby we are not looking into the tabligh group only, but the next of kin, for example, family members or friends that we can have to enhance our contact tracing. So this is important for us to use the expertise in our police force and to help the Ministry of Health to trace the contact tracing. The person that is actually have exposure to the positive patients. So it's 40,000? The information that we have is about 40,000. Yeah.
So does the ministry want to test all 40,000 of them?
No, it helps us. We call it in the Ministry of Health as PUI. Patients are under investigation. Then patient under suspect, for example, suspicion. For example, if we think that the close contact have exposure to the index case, then we try to trace the close contact. No, there will always be a backlog every day because our reporting is on 12, every day at 12 o'clock. So when the reporting, for example, takes more than 24 hours, there will be a backlog at least. So if we continue to test new patients and then the test report is not out yet, there will be a backlog. So after 1 o'clock, then we get the information for the next day. But in the same day, we are also testing more patients. So there will be some form of backlog in that sense. Nonetheless, when we look into our lab, we have actually increased our lab from initially only about 23 labs available in the Ministry of Health as well in the private sector. Today in the Ministry of Health, from 18 labs, we have increased into 20 labs now. And the private sector from 5 to 7. So all in all, we have 27. And one lab in Angkatan Tentera Malaysia, and the other in Malaysian Genomes Institute. And we have 14 labs in the IPTA and IPTS. Total, we have 43 labs. That means it's RT-PCR lab available.
So, Datuk, your expert analysis on this, do you think the MCO should then be extended to make sure that all these backlog cases are settled?
So it's not about I think, but it's about what we can do now to change the figures that we have. So we are monitoring every day. So the responsibility is not only on our shoulders in the Ministry of Health, but all of us have to play a part. Now, if we can keep to staying at home and make sure you wash your hand and social distancing, for example, then let us look into the data. The data will tell us whether we need to extend or not. So now I can't predict. I can predict, but the reality is that we have to base on science and facts. So we hope that by 10th of April, the data is available for us to make a decision whether we need to extend or not.
Datuk, in terms of, now there's another concern in terms of what's happening in the prisons, because a lot of people are being arrested because they're violating the MCO, and then there's concern that whether we have enough screening being done in prisons to avoid an outbreak there. How is KKM addressing
Well, we are addressing, basically we are doing a screening for them in the prison as well. Anywhere we are trying to avoid public gathering. So even in prison, we try to space them out and make sure that social distancing is being practiced even in prison. So what's more important is that, when we try our best to enforce this MCO, and the public must come together as one to have this social discipline. Unless we have social discipline, then we can make it. Otherwise, then we are putting our country at jeopardy in that sense, in terms of not able to implement what we have actually planned.
Just on the prisons as well, the prison department has suggested that maybe people into the jails, into the prisons, but make them do social community service.
But at the moment, we do not have. We have MCO. You see, no movement control order. So we only can put them in prison or in a place that we can quarantine them.
Datuk, ada pula di media sosial mengenai test kit yang dikatakan 99% correct, hanya menggunakan sampel darah dan sedikit medical portion untuk cek whether kita ada positif.
Kalau menggunakan sampel darah, besar kemungkinan ialah test kit yang menggunakan kaedah serologi, iaitu untuk mengukur antibody, respon antibody. Sebagaimana yang saya katakan awal lagi, iaitu kalau antibody IgM dan IgG. Respon IgM mungkin mengambil masa 5 hingga 7 hari. Dan IgG mungkin lepas 7 hari baru dapat IgG punya respon, bergantung pada individu tersebut. Jadi mungkin yang dimaksudkan ialah menggunakan antibody rapid test kit. Tetapi kita telah putuskan antibody test kit tak boleh digunakan untuk diagnosis. So we do have issues with regard to SARI, that means a severe acute respiratory infection, and we have been monitoring SARI since January, looking at the cases now. But what we have to tell our healthcare workers that all SARI patients, you have to treat them as COVID positive until proven otherwise. Because 12 of our healthcare workers been infected because treating cases of pneumonia of SARI, but have not been confirmed as COVID yet. So protection is very important for us. Our healthcare workers must take precaution, all the necessary precaution, and to avoid the infection, to getting the infection. So far, our healthcare workers involved treating SARI is about 12 patients, 12 healthcare workers.
Just coming back to one of the deaths that you mentioned today, the person was found to have died on March 28th. Does that if I didn't mention that
Can't hear you. Can you say?
one of the patients who died has been treated in the hospital. They were suffering clinical denial on March 28th. So is that also due to backlog of testing?
No, that's a reporting. I think there's a delay in reporting. So, for example, in a private hospital or in a setup, they reported to us late. Then so now we have to report it. So that's the issue of reporting. Data ialah kita tengok data setiap hari. Kalau dalam tempoh 6 hari lepas kita nampak ada peningkatan 2 hari lepas, iaitu lebih kurang 218 kes dan lebih daripada 200 2 hari lepas. Dan ini besar kemungkinan sebab kita melaksanakan acute case detection di kawasan yang enhanced MCO tu, iaitu di Kampung Sungai Lui dan juga Simpang Legam. Jadi ada kes pertambahan di situ apabila kita melaksanakan acute case detection. Jadi hari ini dah kurang 100 dah kurang kes berbanding dengan 2 hari lepas. Hari ini baru 150 kes.
Datuk, I would like to ask with regards to the testing which I asked earlier, how many of the daily new infections which are reported are actually people who were tested yesterday, or if they were tested like from 2 days ago? Like today you said 150 new infection cases. Were all these 150 people tested yesterday, or were they from some weeks ago?
Okay, the total case that we are, the testing that we have done over the last couple of weeks, actually total, the cumulative case 47,723, and 70%, equivalent to 35,792, they are the diagnosis, that means the first time testing. 70% of the cases first time. Then the 30% is basically we are doing it for those being treated in a hospital, and then we need to have a serial testing, and particularly before they discharge, we have to do 2 tests negative within more than 24 hours.
Just wondering about the street flooding cluster. So out of the whole cluster, do we know how many more have not been screened? And of those screened, how many of them have not been screened?
So we have been informed during the gathering that there's about 16,000 people and 1,000 foreigners from 25 countries, and local about 14,500. So we do have the figures for about more than 12,000 screened index cases. But now we are not only looking at the index cases for those who have attended the gathering, but also the family members as well as close contact. That's why we get the figure about almost about 40,000, to detect, because within 1 month we have seen the transmission into 5th generation. So the index case infected the 1st generation, 2nd generation, 3rd generation. It continues on the 5th generation. So that's the reason why we need to not only trace the index case, but also the close contact family members. There are 2 groups that actually at risk of infection. Basically, number 1, family members of the close positive case, and second, the healthcare workers, because we deal with a patient all the time. More so if patient comes to our hospital and clinic and hide some of the information. That means, not telling us the truth. This is, then you put the risk of the healthcare workers. For example, in a clinic, or even when come as a patient of SARI, pneumonia, for example. So now we tell all our healthcare workers, to those who are coming with cough and cold, for example, or with symptoms or sign of pneumonia, you must treat them as COVID patient until proven otherwise, although you do not have the investigation yet.
But I'm just wondering on numbers, how many more have not been tested, already screened but not tested yet, and how many more have not even come out for screening?
So the group, we still have about 3,000 of them. We believe that some of them not in the country, some of them perhaps they are in Indonesia, perhaps they have gone abroad, for example in India or even other countries. So we believe that, so they are out there, but we are trying to trace them as best as we could.
This is for screening?
This is to encourage them to come for screening, as well as those who have attended the gathering in Sri Petaling.
But Datuk, sorry, you've mentioned it a few times that we have been looking for them. Will the government employ more drastic measures to bring them home or test them?
One of the reasons is why we are working with our police, because they have the expertise to track and trace people. So I think with their expertise, we'll do. And also we are engaging with NGOs and organizations that help us to reach out to them.
Sehingga 6 ke 12 bulan. Jadi adakah KKM atau kerajaan akan keluarkan SOP on mass gathering, dan adakah ini melibatkan private function seperti itu?
Kita bergantung pada situasi semasa. Jadi sekarang ni kita pun tak tahu lagi. Walaupun kita ada ramalan, iaitu mungkin akan ada peningkatan kes di pertengahan bulan April. Jadi tapi realitinya kita kena lihat data kita. Contohnya hari ini, kalau Malaysian Institute of Economic Research telah ramalkan, hari ini kita mungkin ada 400 kes ke atas. Tetapi pada hakikatnya kita baru ada 150 kes. Berarti kalau kita semua bersama, duduk di rumah, basuh tangan, pastikan penjarakan 1 meter, mungkin kita dapat putuskan rantaian jangkitan kuman ataupun virus COVID-19 ni. Jadi kerjasama antara kita penting untuk pastikan kita dapat membendung ataupun mengengkang penularan jangkitan COVID-19.
Datuk, a week ago you mentioned that 8,000 civil servants were actually planning to go abroad, right? I just want to clarify, did they go abroad or were they...
I think there is more than 8,000 because you look into the Mata Fair, for example, and you can get the information from the Mata Fair during this period of 2 weeks, how many tickets been sold, for example, to Malaysian going abroad. And we fear that if they do go abroad and come back, perhaps more than that, at that point of time, we are looking into our citizens going abroad. But today, we also realize that our students, for example, from overseas are coming back. So this is another challenge for us when we have imported cases. Remember, the first wave related to the tourists from China, basically directly or indirectly. The second wave is basically related to imported cases. So imported cases, anyone coming to our country, then they might be a potential to carry the virus. Therefore, we need to screen them, or we need to quarantine them for at least 14 days.
But that time you said civil servants.
Yeah, civil servants, basically they also buy tickets from the Mata Fair, right? So it's not only to focus in the civil servant, but anyone can actually buy tickets from Mata Fair.
That time you also mentioned about the ministry, like you said one ministry.
The reason I mentioned is because I'm worried, because I'm expecting if the cases coming back, imported cases coming back, not being managed well, and we get a surge of cases, exponential spike of cases in mid of April, maybe, because the infection will take about 2 weeks. So this is the concern that we have, and that's the reason why we implemented this MCO.
So did they manage to leave the country or did not?
As I said, in terms of the data, it's more than 8,000 people. You want the data, you ask the Mata Fair, those tourism, or give it to you, the exact number and figures. To us, those coming back is more important. Now the figures have increased because the students are coming back as well. And some of the workers in overseas, because of the clampdown in more than 172 countries, they are also coming back. Initially, we thought there's 5 countries. We started with China, then Korea, Japan, Italy, and Iran. But now it's almost 172 countries have experienced. Look at US, for example. Look at UK, for example. Spain, etc. Switzerland, etc. So, just to name a few. But those coming back from these countries have a possibility of bringing the infection. So our concern, and I'm sure our neighbors and etc., our main concern is imported cases now. Saya tak pasti sebab yang tu bawah MKN. Jadi kita ada list hotel yang telah dikenal pasti oleh Kementerian Pelancongan. Tetapi apa yang pasti ialah kalau mereka balik, dia akan dialih ataupun dipindahkan. Mereka yang tak ada gejala akan dipindahkan ke hotel tersebut. Mereka yang ada gejala kita akan tahan, kita akan melaksanakan ujian dan kalau dan mungkin akan ditempatkan di hospital kalau positif. So, as we know that the incubation period is 14 days. You may test negative the first day, you may test negative the second or third day, and the 5th day you get positive. From the experience in China, they have informed us that majority of the cases have symptoms the 2nd until the 7th day. So, but some patients have at least 14 days. So, we use 14 days as our incubation period. And there may be 1 or 2 cases being reported more than 14 days. But the mean is 14 days. So we are using it as 14 days. So the possibility of getting infection again is there. That's the reason why we have to quarantine for 14 days.
So the spike was credited due to the students actually being able to mingle around and infect other people?
That's what we have to make sure that when we quarantine, you stay in your hotel room or even a quarantine room, rather than mix around. The moment you mix around, you mingle around, there's a possibility of transmission from one person to another.
Is this the reason for the exponential rise?
What we do know is that they got positive after the examination. Whether they mix around in the middle of the night, we don't know, right? So that's why we need to enforce in terms of make sure that they stay in their room, not only stay at home or stay in their room. So for this group, probably they are mingling around, or because of the incubation period, 14 days. That's a possibility.
But the Sungai Lui cluster was the latest cluster. Why were they all grouped together when the possibility of infection is?
No, we group together because not to group together doesn't mean they stay together, but they should be isolated in their own room.
But 2 beds in one room, right?
Yeah, but the same group, the same cohort. That means you have the same exposure. Likewise, for example, if you are in a family, I'm not going to isolate the mother and father in a different room and the children in a different room. We put together as one cohort and one family.
Is that, sorry, Datuk, but is that the best SOP? Because
In a family, you have to, because, for example, in a family, then you have to put the family together. Rather than, even for example, case 23, that is an American citizen that we have. She is positive, husband is negative. But the husband wanted the wife to be at his side. But we have to sign a consent, then we put them together. Because one is positive, one is negative. So this is the issues that we have, but we're looking into the same cohort. Because same cohort, same exposure.
I was just wondering on the enforced MCO areas, have there been an update in how many cases have been positive?
We do, and when we look into the enforced MCO area, we have 3 areas. One in Kluang, jumlah kes positif di Kluang ada pertambahan 3 kes. Semalam kita laporkan 132 kes, hari ini 135 kes. Bandar Baru Ibrahim Majid ada peningkatan 3 kes kepada 100 kes. Semalam ialah 97, hari ini ialah 100. Lain-lain lokaliti 35 kes, pecahan mengikut Mukim, Ulu Benut 112 kes, Keluang 18, Macap 4 dan Nyo 1. Untuk kluster Hulu Langat, jumlah kes positif Hulu Langat ialah 314 kes, iaitu pertambahan 14 kes. Kampung Sungai Lui 90 kes, iaitu 25 kohort Seri Petaling dan 65 ialah kes kontak rapat. Bukan Kampung Sungai Lui 224 kes. Semalam kita laporkan 210 kes. Berarti 28 daripada kohort Seri Petaling dan 196 kes close contact. Dan Menara Plaza City One, semalam kita laporkan 18 kes. Hanya ada pertambahan 1 kes. Jadi ada 18 kes dibanding dengan semalam hanya 17. Yeah, he has recovered from intubation. I think he needs intubation and ventilation and has recovered. Patient 33 also have discharged. So, and they are doing well. And in fact, he is contacting me directly, to thank Ministry of Health for the services given to them.
Datuk, you said your main concern is imported cases, those that are coming back. Do you have a figure?
That's the reason why every day we were told before the lockdown about 10,000 people comes back every day, 10,000. Now after the lockdown is about 4,000 plus. So we hope that we already control our border and we denied those who are tourists coming from other countries. But we are talking about our own citizens.
So how many of them still our own citizens who are out there yet to come back?
We don't have that figure because unless we can't predict when they're coming back tomorrow, day after tomorrow, and so on.
For the past 3 days.
So what we do know that from today, for example, last 3 days that we implemented in terms of quarantine, we have 752 cases been quarantined in the hotel, for example. And we have 8 cases that is actually positive in terms of the temperature scan and etc. So we need to isolate them and then we continue to investigate them in the hospital.
The test kit currently being used, the RT-CRC, right? Where is it from and can we source for a better test kit? Are we looking at it? What's the
No, there are 2 test kits. One is the rapid test kit, and then the other one is the gold standard is PCR, RT-PCR. So all our 43 hospitals now are hospitals, whether in the public sector or private sector, we are using the RT-PCR. And the capacity that we have a day, we can do maximum to 11,000 now. We hope that we can increase. Today, I think we can do every day is 11,500. So the capacity we can push to 16,500 from the 43 labs that we have, public sector, private sector, university, and Ministry of Health. So we hope that there are another 5 more labs in the process. But more importantly is that the turnaround time may take some time if you use the PCR. So we do have challenges there as well, but we are trying our best to see how best we can increase the capacity in terms of the using the PCR at the moment.
That's the one that gives the most accurate reading.
Most accurate reading.
But it takes longer.
It takes longer, that's right. And the confirmation is using PCR. We do have the test kit, antigen test kit. We've been testing 2 brands from China, 1 brand from Korea. So far not reliable, and the accuracy is below that. One is below 50% and the other was only 56%. So we will continue to test a rapid test kit. The good thing about this rapid test kit is that it's point of care testing, which means we don't need to send the sample to IMR or etc. So with the clinic, for example, doing the swab, and if you have a biosafety cabinet, you can test it there. And the results, probably we will get the result much faster, maximum of 1 or 2 hours maybe. So that depending on the time taken for us to get the swab. So we hope that we will have a reliable test kit. We have been assured that, for example, next week we'll have another test kit coming from Korea. So we are looking forward. Hopefully, they promise us that this is more than 80% accuracy. So if 80% accuracy, we can use it. But if 50% accuracy, it's very difficult for us to use because there will be false positive and false negative. You think you don't have it, then you have the virus. You think you have the virus, you may not have the virus. So this is the issue of false negative and false positive.
So just on the issue of testing, today, yesterday, immigration is saying that Malaysians who are in Singapore, who work in Singapore, they can be tested in Singapore. If they test negative, they can come back without quarantine. Is that advisable?
Our agreement with our counterpart in Singapore is that our workers for health, our workers in Singapore, upon completion of phase 1, and then if they want to come back, they have to be tested in Singapore. So if they are tested negative, then we do not need to repeat again. So we will accept the negative test, and then we do the necessary for them.
Ada dakwaan yang mengatakan pesakit yang telah pulih COVID diambil plasmanya untuk dijadikan ujian serum. Jadi boleh komentar.
Yang setakat ni memang kita ada beberapa kes pesakit kita yang telah sembuh dan telah pun discharge daripada ward, dan mereka ingin untuk dapatkan ataupun contribute kepada sains contohnya lah. Jadi mereka mendermakan darah mereka, dan darah sebelum mereka mendermakan darah mereka, kita akan mensaring untuk jangkitan kuman yang lain, contohnya sama ada hepatitis C dan sebagainya. Kalau mereka sihat, dan juga kita akan laksanakan test semula. Kalau test pun negatif, jadi kita akan ambil darah dia, kita akan asingkan darah merah dengan plasma. Dan plasma tu kita akan hantar ke IMR untuk buat kajian, lihat kepekatan antibody tersebut, dan kita akan, darah merah kita mungkin akan pulang kepada pesakit tersebut. Dan 2 minggu lagi kita akan ambil darah lagi untuk ambilkan plasma dia. Dan plasma ni kita akan kaji, dan kalau antibody dia tinggi, mungkin besar kemungkinan kita boleh gunakan plasma daripada pesakit untuk merawat pesakit yang lain. Ada 2-3 pesakit dah telah tampil ke depan untuk menyumbang pada sains dan teknologi dah kata. Dan kita pun bersyukur dan terima kasih kepada pesakit tersebut kerana mereka rela untuk membantu dalam kita melaksanakan penyidikan dan sains untuk melihat kepekatan antibody ini. Jadi mungkin kita akan lihat antibody IgG dengan IgM dan juga kepekatan antibody tersebut. Kalau boleh kita gunakan antibody ini dan kita boleh bagi kepada pesakit.
Sorry, on vaccine development, I just want to know, previously there was a local company that said they are trying to get in touch with the MOH because they are confident that they've developed something. Has there been other companies that approach KKM to work together on vaccine development?
The vaccine, when we have a discussion with World Health Organization, they are actually looking into a few compounds and in terms of the research on this. And they identified a few, but it's still in a very early phase. So it will take probably about a year or a year and a half before we can get this vaccine in the market. So research is ongoing, and hopefully by doing the research, we can get the vaccine as soon as possible.
Today, the developments are quite positive, you would say, in terms of the development?
It's still in a very early phase now. Okay, thank you.